thanks Carlos, and thanks everyone for staying. And I understand I'm the only thing left between you and refreshments, so I'll try to be very, very quick. I just wanted to cover 4 areas in the Australian context. To look at the regulatory or policy context, some of the background preparatory work we've done looking at attitudes to PrEP among gay men and service providers. Describe the demonstration projects that have either commenced or are starting soon, and then to reflect on some of the lessons we've learned. So in terms of the regulatory and policy context, approval of drugs is a federal responsibility, and the agency responsible for that is the TGA. And no application has currently been made to this point for Truvada as PrEP. And as we heard from Jim Rooney earlier, some of the considerations that would need to be made before filing such an application. And then once that occurs, funding for PrEP is another element which also Jim mentioned, and that is decided through the PBS or Pharmaceutical Benefit Scheme mechanism, or it could be through other arrangements. There are no national or state guidelines for prescribing PrEP, although guidelines are being drafted in one state, New South Wales. The 7th National Strategy, which has just been released, actually mentions PrEP, although rather in a fairly vague way. However, one of the state strategies actually has a much more specific mention of PrEP in terms of keeping a watch on the trials and continuing to support and promote PrEP for people most at risk of infection. In terms of the background work that we've done in looking at attitudes to PrEP and actually use of PrEP, informal or non-prescribed use of antiretrovirals for prevention has been around 2% in studies that we've conducted. But very high levels of PEP awareness and uptake, just to touch on some of that, the issue of PEP and PrEP that was mentioned earlier. In fact, we see around 3.5% up to 4% of people reporting PEP use in the last 6 months, and up to 15% of people reporting ever having used PEP. When we started exploring the idea of willingness to use PrEP, we found around 28% of negative gay men were willing and motivated to use PrEP. And in fact, when we repeated that survey in 2013, that had decreased to 23%. And those most interested were more likely to have an untested or positive regular partner, or to have only casual sex partners. They were actually more likely to perceive themselves at greater risk of becoming positive, had fewer concerns about taking antiretrovirals as PrEP, and that actually previously had post-exposure prophylaxis PEP. We also did some work recently this year on the HIV workforce, so it included clinicians, but also people working in health promotion, advocacy, nursing and so on. And in that study we found that that the participants rated PrEP as moderately effective, and it was lower than either condoms or treatment as prevention. However, greater comfort and likelihood recommending PrEP was higher among people working outside the public or government sector, so those in private or community settings, much more comfortable and likely to recommend it. There was actually no differences between people working in different professions, however. In terms of the demonstration projects, there's 3 in development. One, so that's the first 2, and that's the third. They're in the 3 eastern seaboard states, here in Victoria, in New South Wales and Queensland. I'm not going to go through all the details, but just to mention that it's 450 people in total across the 3 projects. And the reason there are 3 projects is we'd applied for a National Health and Medical Research Council grant to conduct a larger study. That was unsuccessful, so the state governments came forward to fund the studies, and that's why they're 3 separate, although there's a lot of crossover and commonality between the 3, and in fact a lot of the investigators are working, are involved in several of the studies. I just want to come back to that by way of acknowledgements. In terms of the lessons, we've only obviously started last month. The one in Melbourne, which is one that started, involves 3 large GP practices and 1 sexual health centre. There are actually 48 people now enrolled and drug dispensed, and what we found is there's been actually a rapid uptake of available places, and that's in the context of very limited promotion of the project, only through community forums, the website itself, word of mouth, and an email list that had been developed as people expressed interest to the investigators in advance of the project starting. Most participants reported that they were aware of PrEP previously, and they were the ones that initiated going on to PrEP rather than it being offered by the clinician. In terms of motivations, people talked about additional protection, wanting to get access to Truvada. However, also several talked about wanting to, kind of altruistic motivations. They wanted to give something back to the community. A large crossover with use of PEP across the sites. These are the main sites that prescribe PEP, and there's a lot of previous and repeat PEP presenters in this group, and some had reported that they were using PEP as PrEP prior to going on the demonstration project. And since we've started, actually, there's been some change to allow for, to facilitate rollover from PEP straight into PrEP. The issue of PrEP decliners, because the study was designed to enrol an equal number of people who'd accepted PrEP and another 100 who declined PrEP, and to observe the decliners in terms of the differences between differences from the acceptors on various characteristics. However, it's that enrolment to that part of the study has been much lower for reasons I just described, because we're getting a lot of people who are proactively asking for PrEP. There really haven't been any occasions when PrEP has been offered. Sorry, it's only a small number of occasions when PrEP has been offered and being declined thus far. And just finally to mention, there's been concern among the participants who've already enrolled about what happens at the end of a year when their access to Truvada finishes. So we're looking at ways we can facilitate ongoing access. And just to thank all the project partners who have made it possible, particularly Department of Health Victoria and Gilead Sciences, who provided the drug. Thanks very much.